To distribute and administer the vaccine is not progressing as it should.
To give you a sense of just how slow the vaccine rollout has been, here's what the top scientists at Operation Warp Speed promised just 2 weeks ago right here on MSNBC.
Overall, in the month of December, between the two vaccines, the Pfizer and the Moderna vaccine, we expect to have immunized 20 million of our American people and keeping 20 million doses for their second immunization a few weeks later.
20 million vaccinations. With just 2 days left in the month, the CDC says that 2.1 million people have gotten a vaccine. That's a little more than a tenth of what this administration has promised. And some experts are warning that there's just no real plan on how to get this vaccine to every American.
This is frustrating, right? Because it's not like we didn't know vaccines were coming. It's not like this has caught us off guard. Two things have gone on. One is we have not gotten the vaccines out to states as quickly as we were promised. But that, to me, is the less important issue. The more important issue is that there really has not been much of a plan on what happens after the vaccine arrives in states. How do we get it into people's arms? And we just left it up to states, and states are really stretched. We have given them very little money. And we're just we're repeating all the mistakes we made with PPEs and testing all over again. We have two choices. We can either decide that all of our 50 states are failing us. I don't think that's the right way to look at this. Or we can realize that we actually need a federal government to be helping states and not just saying to every state, you're on your own.
It shouldn't come as a surprise that the Trump administration is mishandling yet another aspect of the pandemic response. This administration is run by a president who admitted on tape to downplaying the coronavirus on purpose, who touted unproven cures like hydrochloroquine, who suggested that we inject ourselves with bleach. He held super spreader events at the White House and across the country. He got sick with COVID himself. He ranted against common sense public health restrictions. We could go on and on to the break of dawn. Trump has been largely AWOL during what's been the deadliest month of the pandemic, with more than 63,000 deaths so far. He's been golfing the past 5 out of 6 days. The last time he spoke to the press was December 8th at an Operation Warp Speed summit where he claimed that tens of millions of vaccine doses would be available this month. Since that day, 4.2 million Americans have gotten infected. More than 50,000 people have died from COVID-19. And save for a handful of tweets, Trump has been focused on overturning the results of an election he lost decisively. And of course, he's been focused on his golf game. And all of this means that it's already up to Team Biden to not just deal with the massive logistical challenges of getting this vaccine to each and every American, but also to be honest with the American people about where this pandemic is going. A president-elect with a plan is where we begin this hour with NBC News correspondent Jeff Bennett from Wilmington, Delaware. He's here. Also with us, Eddie Glaude, chair of the Department of African-American Studies at Princeton University and an MSNBC contributor, and Dr. Peter Hotez, the founding dean of the National School of Tropical Medicine at Baylor College of Medicine. Jeff, I'll start with you. So Joe Biden is laying out the facts today. He's laying into the Trump administration. He's talking about his 100 days of asking people to wear a mask. I'm just curious, how effective does Team Biden think that's going to be? Is that sort of a symbolic request, or is that something that they're going to try and put some legislative meat behind? Because from my perspective, everybody who knows to wear a mask is probably already doing it. It's the people who don't want to wear masks that are the real problem.
Yeah, it's a serious request, and that's not the first time the president-elect has said that when he is President Biden, he intends to work with governors and mayors to bring about what would effectively be a national mask mandate. I will tell you, though, his remarks today, to my mind, serve three purposes. One, it was a warning. Joe Biden saying that things as it relates to the pandemic will get worse before they get better. He says, given the holidays, there will be a surge in caseload and death count connected to the pandemic. It was also a calling out of the Trump administration. You have the vice president, the current FDA chief, the current DHS secretary, all on the record saying that by the end of the year, there would be some 20 million vaccinations. Well, the Trump administration has fallen some 18 million people short. And the other purpose I think his speech served was an articulation of a plan. The Trump administration has been focused on getting vaccines distributed. The future Biden administration will be focused on getting Americans vaccinated. It's almost as if the Trump plan stops where the really hard part begins. And the really hard part is getting that vaccine out of those glass vials and into people's arms. And so what you heard from the president-elect was the articulation of a plan that goes beyond getting those, deep frozen boxes out to states. It's working with states and funding those state governments to make sure that, small doctors' offices and retail pharmacies can actually do the hard work and heavy lifting. You also heard him talk about sending mobile units out to hard to reach parts of the country and standing up a real public health program to boost people's acceptance of the vaccine, which will go a long way in helping, communities that have really historically been disenfranchised by the medical community, getting this vaccine that they so desperately need, Jason.
And Jeff, one of the things that Biden has talked about also is bringing out the Defense Production Act so he can ramp up production and get this out there. Look, I can drive by McDonald's that says millions served, right? But that happens because there's a McDonald's on every other corner. If Joe Biden is able to get the Defense Production Act through, what would that actually look like? Does that mean mobile units in every city? What would this look like? What's the administration or the future administration think that if they get that policy through, what that would look like for the American people in, say, 5 or 6 months?
And think of it this way. Joe Biden has talked about getting 100 million vaccinations in people's arms in the first 100 days of his presidency. Okay, well, that's 100 million syringes, 100 million glass vials, 100 million pairs of latex gloves, 100 million masks and gowns that people who administer that vaccine have to wear. So that is why the Defense Production Act is important and where it would come into play, ramping up the production of all of that and ramping up the production of the raw materials that are needed to actually produce the vaccine, so we won't find ourselves in a situation 5 or 6 months down the line where there's this great demand and not enough supply. So this is really the heavy lifting and hard thinking that his transition team has been doing for these last, 80 or so days. And now, in the next 22 days, when Joe Biden is actually sworn in, they've got to hit the ground running. What they don't want to find themselves in a position where they're trying to course correct in real time. So that is why this planning is so crucial, Jason.
Dr. Hotez, I want to play you some sound from Dr. Celine Gounder. She is a part of Biden's advisory board. She's talking about the logistics of getting this vaccine out. I want you to listen to the sound. We'll talk about it on the other side.
We need to be getting to 1 million doses per day if we're going to reach the president-elect's target of 100 million doses in 100 days. And even then, when you consider these are vaccinations or vaccines that require 2 doses of vaccination, you have to multiply the American population by 2, so that's 660 million doses. Divide that by 1 million a day, that's 660 days. So we really need to be ramping up the pace at which we're doing vaccinations.
Dr. Hotez, when I hear this, I don't just think about the raw numbers of how hard this is going to be to get out, but I think about the fall off, right? There's going to be lots of people who may come in for dose number 1, then they need to get busy and they don't come in for dose number 2. What is a realistic number for rolling this out? What is a realistic sort of timeline for getting significant numbers of Americans vaccinated?
Well, remember, we really have no choice by the fact that the Trump administration has not led any federal program. It's all been left to the states. And we're in this dire situation where we're at 3,000 deaths per day and 200,000 new cases a day. And remember what that number really means. Those are underestimates by a factor of 4 or 5. We're talking about 1 million new cases a day. And because we haven't had that national program, we're backed into a corner. We have no choice now but to vaccinate our way out of this. And, all of us worked really hard to try to avoid this situation so we wouldn't be so completely dependent on vaccines. But there you are. So now this has to be all hands on deck and getting 2 doses of vaccine into individuals. And we need those 2 doses because the phase 1 studies show that the level of virus neutralizing antibodies just not adequate after a single dose. You get some protection, but not nearly enough to really get our arms around this pandemic. So that's the plan right now. And unfortunately, our public health system has always come up small every time. It came up small with the diagnostic testing, and it happened again with the virus genome sequencing, the lack of national response. And we're already starting to see missteps with vaccines. So I think what you're hearing today is for the first time, thank God, national ownership, federal ownership, that we're going to solve this problem. And so I think the president-elect's remarks were so important today. You know, the other issue is going to be the fact that, you know, we don't really have a strong health system infrastructure for administering adult vaccines. Our health system infrastructure is overly reliant on the big pharmacy chains, CVS, Rite Aid, Walgreens, if you think about where you're getting adult vaccinations, and that will certainly help. But I think the other thing we heard from the president-elect was the fact that we're going to put these mobile teams in place, create vaccination sites, and that's what you need. You need that federal intervention if you're serious about getting what really needs to be around 200 million Americans vaccinated, because remember, to interrupt transmission, we're going to need, at least our estimates that we did with City University of New York show that you're going to need 60 to 80% of the population, maybe 85% of the population vaccinated. And so that's a huge number. It also means vaccinating children and adolescents at some point down the line as well. So massive undertaking. This is the first time we're really hearing about a plan to actually get vaccines into people's arms.
Eddie, I want you to be my highly educated, incredibly eloquent anger translator right now. You're my anchor translator. I watched that Joe Biden speech, and I see a fighter who's he's pacing in the corner saying, let me at him, let me start solving this problem. I want you to talk about the sort of moral urgency that Joe Biden is expressing here. He's not just saying, yeah, I want to get to my job, I'm excited about my new job. He sounds like he's like, I got to save this country because the guy in office right now is sat there and he's got the blood of 300,000 people in his hands.
Absolutely. I mean, look at this. I mean, I want to return to what Jeff Bennett just laid out for us in the beginning of this segment. He said there were three elements, right? There was the warning that the surge upon the surge is about to happen. You've talked about this before as well, Jason, about what happened during the Christmas holidays, right? In terms of folks, more people travel through TSA than since mid-March. So we know we're going to see a surge upon a surge. We're seeing over 330,000+ Americans dead. We know hospitals are at capacity. So there was the warning. Then there was the calling out, as Jeff laid out, right? The fact that he's actually shining a light on gross negligence, on gross incompetence. But the third point is really important that Jeff made, and that is around the plan. And what the doctor said, right? What we're hearing here is, in some ways, Jason, I think, evidence of, shall we say, the emptiness, the bankruptcy of a particular political ideology.
Yes.
The fact that the federal government isn't doing work is not just simply because of incompetence and gross negligence. It's actually driven by ideological commitments. They don't believe that the federal government should be playing this role. There's a reason we don't have this plan. And so what we have is evidence in testing, and now we see evidence in getting vaccines and arms of a bankrupt ideology that has put the nation in peril. I hope I'm channeling anger, Jason, in that moment.
You're doing a great job. I always want to say, keep that same energy. We're talking about the sort of failures of this administration. Dr. Hotez, I want to bring this back also to sort of the modeling realm. So, you know, we've had Dr. Fauci. He's talked about, hey, look, you know, I have confidence in Joe Biden because I think he's actually going to lead from the top. We saw Senator soon-to-be Vice President Harris getting her vaccine today in Anacostia Hospital, which is a hospital that primarily has a lot of patients and clients who are African-American in the D.C. metropolitan area. Do you think there should be, for symbolic purposes and for modeling purposes, sort of a rollout of local elected officials? Do you think it would matter if Governor DeSantis and Governor DeWine in Ohio and all sorts of governors, should they do a rollout similar to what we're seeing with Senator Harris? Is that the kind of thing that might break through and get people to sort of start being open to this, taking this vaccine?
You know, I think that's an important step, and here's why. 2 weeks ago, the Kaiser Family Foundation released a poll of who's vaccine hesitant in this country and who may refuse vaccines. And you've already pointed out the African-American community has a high rate of vaccine hesitancy and views the government appropriately with a degree of mistrust. And I think that's going to be really important to have leaders from the African-American community and clergy out there getting vaccinated. But the other piece the highest rate of vaccine hesitancy refusal is what they termed Republicans, quote unquote. So and there's a reason why we've seen this virus race through the upper Midwest and Texas all through the summer and fall and in the southern states, is because people have tied their political ideology to being defiant of masks, defiant of contact tracing. So 15 was done under this banner of health freedom, medical freedom coming out of the extreme political right. So we absolutely need individuals like that out there modeling behavior and getting vaccinated as well. Again, if we're really going to interrupt transmission of the virus, our studies have shown up to 80%, maybe more, of the country's going to have to be vaccinated. That's a heavy lift, and we've got to move on this as quickly as possible.
And Jeff, I hate to be a cynic. Well, actually, I don't. Let me just be candid about how I look at this. Does Biden's plan take into consideration sort of what Dr. Hotez was talking about, issues of resistance and security, right? So let's say I live in Central Texas. Let's say I live in Indiana. Let's say I live in Louisiana. I don't have a CVS. I don't have a Walgreens near me. I don't have a Walmart that's got a pharmacy in it. What's going to happen if there's local resistance to the mobile federal truck? What if locals, anti-maskers, alt-right people say, hey, it's the same thing as black helicopters? Does the Biden team have an idea? Are they going to have armored carriers to protect these sort of mobile virus machines? Or are they just assuming that everybody's going to welcome these trucks in with open arms?
You know, that's a great question for which I honestly don't have a good answer. I will tell you this, though. I think it is instructive that for 2 days straight, we've now seen the president-elect call out this administration in ways that he has not done before. And I think it actually speaks to your question. Yesterday, he was talking about the roadblocks that the Pentagon is putting up so that his own administration doesn't have a good view of the posture of the military around the world and doesn't have a good enough view of the national security threats here in this country. And so when you talk about does the vaccine need to be transported in armored trucks, well, potentially, maybe it does. But what we saw from the president-elect yesterday, he was saying they don't know enough to actually know the answer to that question. And then today, he was talking about the specifics of getting the vaccine distributed and getting it into people's arms. And so, you know, this is someone, Joe Biden, who has talked a lot about how he wants to lower the temperature of our politics following 4 years of President Trump. But, you know, given the fact that he becomes president in 22 days and he will inherit the challenges and, frankly, the problems that have been created by this outgoing administration, I think he is speaking to directly some of the issues that you posit in your question, Jason.
Okay. Oh, we are not done with this. Jeff Bennett and Peter Hotez, thank you for starting us off. It's been great. Eddie is sticking around for the rest of the show. When we come back, the increased stimulus checks so badly needed now depend on the GOP Senate, specifically Mitch McConnell. It's still unclear what he'll do to help a struggling America, even as Trump lashes out at him for rejecting his demands. And coast to coast, people came out this year to fight against racial injustice, sparked by the police killing of George Floyd. We'll look back at the Black Lives Matter movement in 2020 and what we can expect to see in 2021. Plus, the counter-reaction to it all, a rise in white nationalist terror groups and aggressive, heavily armed police forces. We'll talk about all of that and more when Deadline White House continues after this. Don't go anywhere.